Hello and good afternoon, everyone. I'm Adrian Dix, BC's Minister of Health, and today's MC. Before we begin our event, I'd like to acknowledge, of course, with respect, the traditional ancestral territory of the Coast Salish people to be here on their lands today. I want to introduce some of the people who are with us today, in particular, my colleagues in the legislature, Aman Singh, the MLA for Richmond-Queensborough, MLA for Richmond South Centre, and MLA Kelly Green from Richmond Steveston. As we share some important news, all of these MLAs have been strong advocates for the very things that announcing today. It's also a great honor for me to introduce Graham Kierstead, KC, the Deputy Registrar of the College of Physicians and Surgeons, who's with us today in the audience. We're very honored to have Graham here. For the college, they've done very significant work. I just want to introduce first the guest speakers today, Premier David Eby, of course, Dr. Ramneek Dosanjh, the President of the Doctors of BC, and Dr. who will join us virtually today, a family doctor currently working at the Arbutus Family Medicine Center Clinic in Victoria. In September, we announced a health human resources strategy, which has 5 actions to strengthen British Columbia's health workforce and build a stronger healthcare system for all of us. Today, I'm very glad to be here as we announce some of the next steps in moving forward with our plan. And with that, I'm honored to Premier David Eby.
Thanks very much, Adrian. It's an honor to join you on the traditional territory of the Coast Salish people. Thank you for the introduction, Adrian. Colleagues here today, and friends from the medical profession and the regulator as well. Our shared goal today, as every day, is to make sure that every British Columbian gets the care they need when they need it. The pandemic really exposed some of the challenges in our healthcare system and gave us additional challenges in how we deliver healthcare. The strains that it placed on the system resulted in too many people a family physician, among other challenges. I certainly hear that out in the community. As many of you will know, my wife is a family doctor. And so many times people ask, what is she taking new patients? And we'll talk about the challenges that they not having a family doctor. And I see it in her work. I see what she does for families, how she connects them to the healthcare system and to experts in medical practice. I understand the urgency that British Columbians face and why they need a family. What BC is experiencing is not unique to our province. Healthcare systems across the country are under this kind of stress. Now, some are proposing, to respond to this stress, that we undercut the principles of universal public health. They promote a pay-as-you-go approach, allowing the wealthiest to jump the line to the front by buying their way to the front of the line. It's not right. Buying your way to the front of the line doesn't solve the line, it just changes who gets. Universal public health care is one of Canada's great achievements. Everyone deserves the best possible health care. We can't privatize our way to a better healthcare system, and we can't cut supports and get more doctors. Sense. The pandemic also taught us that going alone doesn't work. If we're going to solve these problems, we have to find them together. Patients in British Columbia deserve the best, whether receiving primary care through that family doctor, healthcare system, with a doctor, nurse, medical staff, or getting acute care in a hospital for complex, critical, and chronic illnesses. We're making those investments in hospitals and acute care clinics. We're making investments in nurses and other healthcare workers. We've revised the funding model to encourage more family doctors to practice in our province. While many are challenged to find a family doctor, we actually have family doctors who are trained outside of Canada who aren't able to practice family medicine in British Columbia. They lack a pathway to be licensed to practice here. Now, when I was in Chilliwack on the leadership campaign, I was hosted by a doctor and his wife, a dentist, and they both worked for the local school board instead of working as in their trained profession. Pathway to practice. We need to fix this. That's why we're taking action to get more internationally trained doctors off the sidelines and into clinics where they're so desperately needed. Today, we are expanding the practice program. This will make it easier for family physicians trained internationally to be licensed to practice in British Columbia. The program will triple from 32 seats to 96 over the next 2 years. As well, by working with the College of Physicians and Surgeons of BC, other international medical graduates will qualify as associate physicians. They will be able to care for patients under the supervision of an attending physician at an acute care facility. We are also working with the regulatory colleges to ensure international medical graduates can start the accreditation process before arriving in the province. And the College of Physicians and Surgeons of BC will prepare bylaw changes to allow doctors trained in the U.S. for 3 years to practice medicine in community settings, including caring for adult and pediatric patients, as well as providing emergency and urgent care. These changes will be implemented in the coming weeks with the intent to allow these doctors to practice medicine in BC by January. Every step we take gets us closer to our goal. We're working hard to create a British Columbia where everyone can build a good life. I am dedicated to making sure everyone in this province gets the health care that they need. I would expect no less for my family or for yours. Thank you very much.
Thank you very much, Premier Eby. The steps we are taking to removing barriers for more internationally educated doctors to join BC's health system are going to make a big impact. We know our province needs more physicians in the short and in the long-term care. And these actions, historic actions today, will help address that need in a meaningful way. There are many reasons why many people, such as foreign-trained physicians, choose to come live and work in BC. Our province has one of the most diverse populations in Canada. Currently, there are 4,451 international medical graduates practicing in BC, 2,570 of whom are family doctors. Expanding the Practice Ready Assessment Program, which we sometimes call PRABC, will simply allow us to welcome more internationally trained physicians who have completed their residency in family medicine outside of Canada to contribute their skills, experience, and training in primary care settings across BC. Family physicians who are seeking a pathway to full or provisional licensure to practice medicine in BC can apply to the Practice Ready Assessment Program. Those who are successful during the PRABC's assessment process will complete a 3-year return of service in communities of greatest need. This means more patients in rural and remote communities will have greater access to the high-quality care that they need, and in addition, underserved communities will be supported in a more significant way. The move from 32 to 96, a tripling of this program, is a major investment by the province in the future of public health care, and I'm very proud, and I know the Premier is, as he has been a consistent advocate on this question, are very proud of this approach. On associate physicians, the new associate physician class introduced by the College of Physicians and Surgeons of BC will allow practitioners with specialty training to contribute their skills and expertise while working under the supervision of a practicing physician until they can become licensed. This will help us increase capacity in high-need areas such as acute care. On the accreditation process, Premier Eby referenced the physician from Pakistan living in the interior BC, I believe, and talked about a physician in the Fraser Valley as well. It can be daunting to move to a new country without a guarantee that they will qualify to practice upon arrival. We can help change this by allowing doctors who are considering moving to BC to complete their assessments in their home country. By offering the opportunity to do the assessment before moving, we are removing this uncertainty and helping them feel comfortable as they plan their new life in British Columbia. Lastly, the changes that are being made by the Colleges of Physicians and Surgeons will make it easier for doctors in the United States to work in BC, to come and work here right away. This applies to doctors who are certified by the American Board of Medical Specialties and receive 3 years of accredited specialty training in pediatrics, emergency medicine, or internal medicine. This is extremely good news for British Columbia and reflects the commitment of the College of Physicians and Surgeons to help address some of the challenges facing our healthcare system. None of these changes would be possible without the collaboration and support of our partners at the Doctors of BC. They've been a key partner over recent years and months in building the path forward for a stronger healthcare system. And here on their behalf, we've had a few announcements recently, is Dr. Ramnik Dosanjh. I wanted to introduce her now to say a few words. Dr. Dosanjh.
Thank you, Minister Dix. I also want to acknowledge the land of the Coast Salish people that I'm getting to announce, and we are very pleased that the provincial government is making it easier for more U.S. and internationally trained family doctors to come to British Columbia and practice. This is something that Doctors of BC has long advocated for. We are all well aware of the very real challenges in primary care that have been with us for far too long. So any effort to address these problems is welcome. Patients and doctors need all the help they can get. Increasing the number of family doctors we will allow to come to British Columbia and practice, fully qualified doctors who have been dreaming about coming here but have only encountered roadblocks thus far, will not only support our existing family doctors, but will be beneficial for our patients, so many of whom are looking for someone to take care of them now. We welcome this component of a much larger action plan to address challenges with family doctor shortages and lack of patient access, and making it so doctors trained elsewhere can easily move to British Columbia is a great step. I also know in my own journey, I'm a U.S. trained physician, and this is a much needed relief to many of my colleagues looking to come to practice in British Columbia. BC's family doctors have made it clear to us that the challenges in primary care and that we are advocating on their behalf. Doctors of BC has been working collaboratively with the Health Ministry to bring about the changes to family medicine more appealing. Introducing the new family physician payment model is a huge component to strengthening the primary care in this province, and improving the ability of foreign-trained doctors to come to British Columbia and practice is another critical component. We also know that all BC doctors face additional pressures, including administrative burdens that either take valuable time away from their direct patient care during the day or take valuable time away from their families in the evenings. We are advocating on behalf of BC doctors to address these burdens, to find better and more efficient ways of dealing with paperwork, charting, and electronic medical record components. We are also supportive and working with our government partners on changes to how primary care networks are working. So far, BC to admit more doctors in this province who are trained and have worked elsewhere in countries which we know the quality of the education and abilities of these doctors is a very crucial and important step, and we welcome it wholeheartedly. Foreign trained and experienced doctors are vital members of the BC's medical profession. Thank you very much for allowing us to be part of this celebration today.
Thank you very much, Dr. Dosanjh. It's now my honor to introduce someone via Zoom, which I know is the favorite part of any presentation in this day and age. And I want to introduce Dr. Ihab Fadel. Dr. Fadel has done his medical training in Qatar and some extra training in geriatrics in the United States. He is now a family doctor in Victoria after completing the Practice Ready assessment earlier this year. So I want to introduce Dr. Fadel.
Hello and good afternoon, everyone. Thank you to Premier David Eby and Minister Dix for inviting me to speak today. My name is Dr. Ihab Fadel, and I'm a family physician at the Arbutus Family Medicine Clinic in Victoria. I'm joining you today from the traditional territory of the Lekwungen peoples, especially the Songhees and Esquimalt First Nations. Today's announcement is great news for doctors like me, who were trained outside of Canada. I completed my family medicine training in Qatar and did also further training in the United States in geriatrics. I was interested in living and working in British Columbia because I wanted to live in a safe place with beautiful nature, a place where everyone is welcomed and respected. After doing my required exams, I came to Vancouver in April to begin the practice ready assessment, where I learned not only about the medical system in Canada, but also about Indigenous health and cultures in BC. I then moved to Duncan and worked under the supervision of a family physician for 12 weeks until I completed the assessment. In September, I started working as a family physician at Arbutus Family Medicine Clinic, and I'm very happy to be part of the team and to get to know the community and my new patients. This program fully prepared me to be a successful family physician in British Columbia, and I'm very glad to hear its expansion so that more doctors can live and build their career in BC, like myself. Thank you to everyone that made this happen. This is great news for doctors like me and patients alike. Thank you.
Well, and thank you, Dr. Fidel, and I think I speak on behalf of everyone here when I say that BC is lucky to have you, and that the expansion of this program and opportunities for internationally trained doctors to work and provide care, particularly in primary care in British Columbia, is an important change. It's been a valuable program, and it is going to get dramatically bigger over time. I want to say that this, of course, announcement is part of the government's Health Human Resources Plan, and particularly with as it relates to doctors and family doctors and the need for more doctors. You've seen significant change in the last number of months. We started new to practice contracts. 86 contracts have been signed under the new to practice contracts. Typically that number is about 20. That was put forward, announced, and implemented over the summer. In August with Dr. Desange, we met and provided interim funding to support clinics throughout British Columbia. Interim funding that is close to fully subscribed, a major and important new step. In October, we announced our Health Human Resources Plan that included 128 new seats at the University of British Columbia. Later in that month, we announced our new agreement with the Doctors of BC that fundamentally transforms primary care and improves primary care for patients and for those working in primary care and in team-based care in BC. It was a result of months of collaboration with the Doctors of BC. And subsequent to that, we signed an agreement with the resident doctors of BC, an important component of the future of BC's healthcare system. And today we're making this announcement very much under the impetus of Premier Eby, who made this a fundamental issue for him going forward. And so, as you see over the last number of months, this announcement, one of the most significant for the future of the healthcare system we've seen, builds on a base of a series of steps we've taken in this period of pandemic and challenge for the healthcare system that will make a huge difference for people. So thank you very much for coming today. It's now time to take questions. I want to invite Premier Eby back to the podium, and we look forward to taking media questions.
Thanks very much, Minister Dix. Happy to take any questions.
So for media on the line, please press *1 to enter the queue. You'll be limited to one question and one follow-up, and please remember to take yourself off speakerphone before asking your question. Our first question will go to Coast County.
Mr. Premier, Kelly Moore from CTV. Just wanted to ask you, as far as you know, does any other province have these kinds of UC restrictions?
Let me turn that back over to you, Adrian.
I think a number of other provinces are doing different things right now. For example, in British Columbia, because we know it's not just we need to build out the whole healthcare team. We made significant changes to make it easier for internationally educated nurses to work in BC. Those changes have been taken up by other provinces since we've announced them. Other provinces are obviously taking steps to do this as well. But what we're doing here, I think, is transformative in a number of ways. The Practice Ready Assessment Program is a major way that we recruit internationally educated doctors to British Columbia. We're tripling that over the next 2 years, a significant change that will make a difference in the lives of a lot of people receiving primary care. We're also making it easier for U.S. trained doctors in the United States, many of whom wish to come to Canadian jurisdictions to practice here. And we're working with other health ministers. So as you'll recall, we had a meeting of health ministers last month. And in that meeting, a lot of the work we did together was to break down those barriers, because we don't want this just to be good for British Columbia. We want it to be good everywhere. So other provinces are doing their own work in this area, and that's important. But we want to be combined. This is not this cannot become a battle between Canadian provinces. All provinces have to break down barriers across the country. We're going to do it, and we are doing it together. I'm very proud of the work that health ministers are doing, and we're also doing some work with the federal government on broader issues of immigration to make it easier for doctors and nurses and allied health workers to come to BC.
Do you have a follow-up?
I do, for Dr. Tonsange, if you don't mind.
We'll do this.
And just briefly, can you just tell us how critical the shortage is right now?
I think the patients have spoken on the legislative lawn in May. We know that nearly 1 million patients, 20% of our population, are without a family doctor. And we know that the burdens that our specialists and our consultants are feeling with the increasing wait lists, and we see the increased wait time and demand in acute care facilities. This is critically important for us to be able to address all of our healthcare crises, and there are multiple crises happening simultaneously. And this is, again, another collective effort with our ministry partners to move in the direction of addressing the healthcare human resource issues. Thank you.
The next question will go to Andrea Wu, Globe and Mail.
Hi, I think this question might be for the minister. I'm wondering what the challenges or barriers were to expanding the number of seats available for the PRA program, and what the province did to address those challenges. And I just wanted to confirm that while the PRA program was historically for people in rural and remote communities, that now doctors will be placed in urban communities as well.
That's right. It will remain an important program for rural and remote communities. The majority of people over the time of the program have been placed, for example, in the Northern and Interior Health Authorities, with some in another group being the north of Vancouver Island or more rural and remote parts of Vancouver Island. So currently there's 32 spaces in the program. It will build to 96. Of those 32 spaces, 16 are reserved for rural and remote areas. So it's against a return of service. So when people are in the program, they get assigned to specific locations that are of need. And 16 can be for rural and remote, but also for urban and suburban communities of need. As we expand out the program, obviously we'll be able to continue to fill those rural and remote demands while building on our urban and suburban needs. So it's a significant thing. Part of it is resources, and we are applying resources in each case. So we're building out from 32 to 48 to 96 in 2 years. And that's, of course, requires, and part of the key part of our agreement with the doctors of BC was properly rewarding the extraordinary work that doctors in BC do to support these programs, as in addition to all of the other things they do. So it requires the application of resources, but I think there is a strong need here now. The program has proven to be successful. It allows us to address specific needs in the present and increase the supply of family doctors. And just to put it in context, you think, well, there are classes of 188. So when you go from 32 to 96, that's a massive increase just in one component. But we also believe on the associate physician side, there will be right now, some 300 doctors in BC who don't meet current standard, who can meet the standard of an associate physician. That gives us an opportunity there. And then we also believe by reducing the barriers to U.S. trained doctors and doctors from other countries, there's a possibility there. So all of these together are a significant change, a significant opening up of the system that's needed at this time. But what does it require? It requires post-secondary education. It requires doctors working in BC to support the program, and that's why we're so proud of the partnerships we've made.
Do you have a follow-up?
I do. Thank you for that. My second question, we've heard from several internationally educated doctors who described the overall licensure process as very lengthy, sort of onerous, to the point of being discouraging. So for example, I can take up to 6 months to verify credentials. It can take up to 8 weeks to obtain test scores. For someone who was educated in the United Kingdom, it could be at least a year altogether. So aside from being able to begin that process in their home country, have there been other efforts to streamline that process?
Yes, and there will be more efforts announced as we continue to build on these changes on issues of equivalency between jurisdictions. So you see here is a significant change for the United States, and we'll build out with other jurisdictions. You're quite right. People get discouraged in this process. And does it work? It's working for nurses right now. We understand the success of what we announced in February in terms of breaking down the barriers for internationally educated nurses is significant. In particular, the Triple Track Initiative and the bursaries that have been put forward that have reduced the cost of that. We've already seen that success, and be happy to share some of the information on that for nurses. We believe that these changes will have the same positive effect for doctors. And so we've got to continue to move through that, working with the College of Physicians and Surgeons, and we will, and we are.
The next question is for Catherine Dibb, Radio-Canada.
Oui, bonjour. La question sera en français pour Monsieur Dix. Désolée. Donc, en fait, je me demandais, on parlait du fait qu'il y a 1 million de Britanno-Colombiens présentement qui n'ont pas accès à un médecin de famille. Vous avez annoncé aujourd'hui une série de mesures, tripler le nombre de personnes qui pourront accéder à ce programme-là, faciliter l'accès des médecins américains vers le Canada en Colombie-Britannique. Et je me demandais concrètement comment ça va répondre à diminuer le nombre de patients qui attendent pour un médecin de famille. À quoi on s'attend en termes de changement?
Mais c'est un changement quand même fondamental, hein? D'une certaine manière, ce qu'on a fait depuis 6 mois, après ce qu'on a fait avant avec le travail en équipe des médecins, des infirmières et d'autres, est un changement fondamental. Hein? Et on voit cela dans tous les domaines. Mais aujourd'hui, de tripler le nombre de médecins qui vont être en Colombie-Britannique contre un retour de service est un changement important. L'entente avec les médecins de la Colombie-Britannique, un progrès fondamental qui change le système, ce qui est essentiel pour maintenir et pour retenir nos médecins actuels et pour promouvoir la profession en Colombie-Britannique. Tous les changements du collège qu'on a annoncé aujourd'hui aussi vont avoir un effet significant. Donc, dans tous les domaines, on fait des changements importants. Et depuis quand même 4 ans, on a créé 1200 positions dans les équipes un peu partout dans la Colombie-Britannique qui ajoutent aux soins pour les gens. Finalement, je dirais, on vit une période de COVID-19. C'est bien difficile, c'est une période de pandémie. On vit avec depuis 2 ans et demi maintenant. Cela a eu un effet profond sur tous les éléments de notre système de santé. Et le travail de nos professionnels et de nos travailleurs est un travail extraordinaire depuis quelques années. Et mais quand même, il faut aussi préparer pour aujourd'hui et pour l'avenir. Et ces changements d'aujourd'hui vont nous aider beaucoup à faire cela.
Oui, j'ai une deuxième question. On sait que la pénurie de personnel dans le milieu de la santé est pas mal répandue ici comme ailleurs. Et je me demandais, pour les autres professionnels de la santé, comme des infirmières, des préposés, etc., est-ce qu'on va aussi aller faire ce genre de programme ou est-ce qu'on reconnaîtrait des équivalences des personnes formées à l'étranger, comme par exemple des infirmières?
On va avoir quelque chose de nouveau bientôt, je dirais, cette année, des changements. Mais on a fait un changement au mois de février et c'est déjà une réussite dans le système. Hein? Donc, c'était en février pour les infirmières qui étaient premiers dans le domaine. On a ajouté 604 sièges dans nos universités pour les infirmières aussi. 336 places pour des autres travailleurs spécialistes des sciences de la santé. Et donc, ça continue, ce travail continue. Nous avons un Health Human Resources Plan qui a 75 éléments, 75 actions. Aujourd'hui, c'est une action. On a fait le plan depuis quelques mois.
Next, we'll move to questions on the line. And first we have Brenna Owen, Canadian Press.
Hi there. It's a little bit hard to hear, but I think I just heard my name. I was just wondering about the 96 seats. Just to clarify, like, is that annually there will be 96 seats that folks can apply for?
Yes.
Did you have a follow-up?
Okay. And I was just wondering, Minister Dix, you said 300 people in BC was the estimate that might be eligible for the associate physician class. I'm wondering if there's a gauge around how many people who aren't already in the province you might expect to see engaging with that program or with that new class.
Well, I think people who aren't in BC are, in many respects, the focus of the Practice Ready Assessment Program, of the changes that we're working on with the college, which are significant and historic changes and reflect the commitment not just of the government and of the doctors of BC, but the College of Physicians and Surgeons to progress. And then potentially, of course, there are many more. That number would be much higher. What we want to do is build into the healthcare system a significant role for associate physicians that allows them to grow in terms of their professional status, but also to provide support and care now. And that's why those changes are in place. So that's our estimate of people who are currently would be eligible for that program, but are not eligible to practice as doctors in BC. This is sometimes a discussion. Sometimes I've heard numbers of thousands. It's clearly hundreds, but this will again be another element to support our healthcare system now and into the future. And so I think it makes a lot of sense, and that's why we're so appreciative of the College of Physicians and Surgeons moving so quickly to ensure that associate doctors can work in BC, and the first will be working in December.
The next question goes to Mary Brooks from Island Social News. Go ahead, Mary.
Hi, Island Social Trends. So this sounds like good news, bringing more doctors into the system. I'm just wondering if you have any desired allotment toward the different health authorities and urban centres, particularly Metro Vancouver and Greater Victoria.
Yeah, so I went through this a little bit in the previous answer. The Practice Ready Assessment Program, which is one of the initiatives put forward today, has traditionally been focused on rural and remote areas. So people will come here. Not all of them stay in those communities, but they stay in those communities for 3 years, right? And against that, a return of service for being part of the program. And then obviously they're available either in that community or elsewhere. And so if you look at the Practice Ready Assessment Program, the 32 now, half of them are reserved for rural and remote areas, and half can go to rural and remote areas or urban, suburban areas of need. So clearly this is going to be helpful in communities such as Victoria, where we have, people often talk about a population or an increasing number of citizens over 75, but also an increasing number of older family doctors, for example, in those communities. So clearly Victoria is a place, and you heard it earlier, which is a place where people in the Practice Ready Assessment Program will practice because there's significant need there.
Mary, did you have a follow-up?
Okay. Yes, thanks. It was actually hard to hear some of the earlier audio. So the specialties in pediatrics, ER, and internal that you mentioned earlier, that sounds like hospital focus. Would that be, again, toward urban? And also, are you looking for physician specialties in the mental health and opioid crisis area?
Well, yes, and we're working significantly on those. The investments in those areas are significant and massive. And if you look at the increase, we have the largest family medicine program in Canada now. Some of the most significant increases have been in those areas already, and will continue to be a focus for ourselves and our partners in healthcare. So I think the short answer to that question is we'll see some of that as well, I would argue, though. And I think Dr. Desange would agree with this, that at the core of primary care is providing care for mental health and addiction services. So when we built out primary care networks together, and there are 59 in the province, and hired net new 1,200 new workers, including doctors, nurses, allied health professionals, the largest group of workers hired under that have been to support mental health and addictions, including counseling services and others. So meeting that demand is, I think, critically important, and that's what we need to do.
The next question goes to Andrew Ross, CBC News. Go ahead, Andrew.
Hi, it's actually Josh Grand with CBC, just calling from Andrew's old desk. I just also have a question just to get some more clarification. I mean, you're opening up 92 spots in the practice ready assessment program. How long does it take physicians on average to get through all of these pre-screening requirements, and you're hoping to have doctors practicing in January, but I mean, how long does it take for different people to get through the program? And is this, like as was mentioned previously, 92 new doctors in BC every year, hopefully? Is that the goal?
Under that program, yes. The goal is obviously more than that. And there's two reasons for that. One, we need to build out the number of both family doctors and doctors in our system, as we do nurses, as we do health sciences professionals, as we do healthcare workers. And I won't bore you with the long list of things we're doing in those areas. But what this involves is a relatively short preparation and then 3 years of work in the community in terms of return of service. These are individuals eligible for those programs who have done their full training elsewhere. And so you heard, you've heard from our doctors today the process, which is a relatively short process to get forward and into physicians' offices across the province. So this is, and this will be a continuing process as we go to year to year to year. And we know we're successful in this program because we've done it for a number of years with 32, and we believe and we know we have the capacity to build that out, and that's what we're going to do.
Do you have a follow-up, Josh?
Thank you. And just as a follow-up, I just want to repeat the question my colleague asked earlier in French. We know 1 million people are hoping to get a family doctor, or waiting to get a family doctor, don't have one right now. All of these programs together, you're looking at, maybe a few hundred people able to care for patients directly in addition per year. What other options are you looking at to really tackle that massive shortfall of family doctors here in BC? And this is some great initiatives announced today. I'm just wondering how you're looking at such a high number of people waiting.
So I think it's important to understand the numbers. In 2003, there were about 300,000 people in BC without a family doctor. When I became Minister of Health, that number had climbed to more than 900,000. And so it's been a period of time. In fact, the number of people without a family doctor increased in every Canadian Community Health Service survey for British Columbia, which is the main way we judge that, in every year from 2003 on. And it only stabilized with some of the measures we took in 2018 and 19. With the pandemic, there have been new challenges. But if you look at our agreement with the doctors, you'll see that a doctor will be responsible, depending on the level of complexity of the patients, for more than 1,200 patients. And so when you talk about adding doctors every year, that's what you're talking about in terms of attachment of patients. It can be a significant thing. In addition, our doctors are working, and part of our agreement with the doctors of BC and part of the work we've been doing is working in teams. So we've, in the past 4 years, doubled the number of nurse practitioners in our system, dramatically increased the number of nurses that work with doctors, and now are adding associate physicians to that to build out team-based care in communities, which can mean counselors, it can mean allied health workers, it can mean dietitians, it can mean nurses, and of course doctors. So all of these steps, it is a range and a significant primary care plan. And then I think we laid out during this announcement the 6 or 7 or 8 major steps we've taken, most notably our agreement with the doctors of BC, but also increase in nursing spaces, support for nurses and other healthcare workers in acute care facilities with better security and safety, and the increase in allied health spaces as all. Since I became Minister of Health, we've added 38,000 net. This is net new healthcare workers, doctors and nurses and health sciences professionals. And you know what? That's pretty good. That's impressive in these times and these challenges. We got to do it again And then we got to do it again in the 5 years after that, and the 5 years coming up, and the 5 years after that. And that's net new workers. So that's why we have a health human resources plan, not with one action, with 75. And we laid that out earlier this year.
We have time for one last question today, and that's going to go to Jane Skripnik from Black Press.
Hey there, thanks for taking my question. I'm just wondering whether there is actually a wait list for the Practice Ready Assessment Program, and if so, how many people are on it? And if not, if you have an idea of how many people are still looking to take part in it.
Well, I think it's clear that we could take more doctors into the program, and that's why we're increasing the number of spaces. And each year there's a new group that comes into the program and is practicing, and it builds year unto year such that we have hundreds of doctors in BC now who've worked through the Practice Ready Assessment Program, the majority of which did their program, their return of service in the Northern and Interior Health Authorities. So we think that there's demand for people to come to BC. We think the situation in primary care with our partnership with the doctors of BC is stronger than it's ever been, and we're going to be able to recruit more people to come to BC. And this is a straightforward and important way for people from all over the world who are qualified to come to BC and provide care for British Columbians as soon as possible. It's been effective for a long time. We're now saying it'll be 3 times as effective as we add 3 times as many people in the program.
Jane, do you have a follow-up?
Yeah, thank you. I'm also hoping to clarify on the restricted registration program. Is that something entirely new, or is it just something you're expanding upon?
In terms of the associate physician program, I think that program is new. One of the challenges and one of the things that Premier Eby has clearly said to me is we need to address some of these issues where we have people with very significant healthcare training who are not working in healthcare in our province. And we talked about this in case of specific people, and one of the advantages for Premier Eby working in the leadership campaign is meeting people around the province. And this was a key issue that was brought to his attention in that time. And so I think, I myself think that the associate physician program, Practice Ready Assessment, addresses pathways for one group of doctors. The changes we've made with the College of Physician Surgeons are going to make a big difference with U.S. trained doctors. The changes we've made in terms of being able to assess in your home country are going to make a difference for a whole bunch of other group of doctors. And for associate physicians, particularly for people who've trained as doctors and are working in BC, it will provide a pathway and work that recognizes their skills in the healthcare system under the supervision of doctors. All of these are significant steps forward, and I'm looking forward, and I know we are, to their success. This is something, and I'm going to ask Premier Eby to come back to close, is something that people have been talking about for a long time. We talked about 300,000 people without a family doctor in 2003, and it getting worse every year after that. And almost no action was taken. The government announced in 2011 they were going to find, or 2009 it was in fact, a former health minister who announced that. And then at the end of that program, they abandoned the program that was supposed to deliver a family doctor to everybody. We've been waiting a long time for these changes. The changes that we worked on together with the doctors of BC are fundamental changes that have been, that I think a fair person would say could have been implemented a long time ago. We did it together in partnership now, and they're going to make a big difference. We've got a lot of work to do, though, and we're going to keep doing that work. And I want to invite Premier Eby back up to say a few final words.
Thank you very much, Minister Dix, and thank you to Mr. Kierstead, KC, pardon me, from the College of Physicians and Surgeons, and Dr. Desange from Doctors of BC. What you've heard today is cooperation between the registrar, between the doctors, and the Ministry of Health to make sure we don't leave any health professionals sitting on the sideline while families are looking for a doctor. Getting those doctors into work to the extent that they're able to do so as quickly as possible, and focusing on making sure they're delivering care for British Columbians is what underlines this announcement. And we need to continue that work as a province, not just in the area of medicine, but across a number of skilled trades. I want to congratulate the leaders from the medical health profession, Doctors of BC, and the college for working proactively on this, for recognizing where British Columbians are, what they need, and really getting out ahead to make sure that these physicians are able to do that work for British Columbians. Thank you very much for your work, and thank you, Minister Dix, and my colleagues for your advocacy on this important issue. Thanks very much for coming today.
Thanks, everyone. That concludes today's event.